Hello and welcome to HSM 430. For today's class, we are going to be discussing communicating with diverse groups. We have a couple of learning objectives. The first is to discuss how a patient's perspective may differ from that of a healthcare professional. Secondly, we are going to describe different cultural perspectives and how they impact health delivery. And then lastly, discuss healthcare and communication best practices when it comes to providing services to diverse patient groups. So, starting with patient perspective, one of the key considerations to have in mind as a healthcare provider is or healthcare professional is that communication can be more challenging when you are interacting with people that are different from yourself. And when it comes to delivering care, you're more likely to going to be encountering people that are different from you than you're going to be encountering people that are the same as you, and they could be different from you in terms of gender or race or age or country where they're coming from. So understanding that these differences exist and they could be causing some challenges to communication does help you in preparing for situations such as that. So diversity exists in different forms. It could be in form of age, race, sexual orientation, socioeconomic status, or religion. They're just different ways in which diversity can exist. So being aware of that your patient group has diversity does help you in finding better ways to communicate with them and therefore yielding better communication between you and your patients. And also it is important to recognize similarities that you would have with patients, even patients that may seem to be wholly different from you. If you make conscious decisions to identify some similarities that you may have with the patient, it does give you guys something to connect with, some sort sense of familiarity that improves mutual understanding and mutual respect that you would have. So that's something that is important. So also alongside recognizing similarities is being conscious to pause and consider any personal biases you may have. Now, with personal biases, and why it's important to recognize having them is because maybe within you think this is an innocuous statement or this doesn't mean anything. Meanwhile, to the recipients of the joke or whatever it is that you said will take absolute offense to it, and this would then make your conversation or your communication awkward, and they may be less inclined to see you the next time that they want to see a healthcare professional. So do take some minutes to pause and consider it, and before you say that, or you could just go ahead and avoid saying it altogether. So diversity in your patient's experience. In order as a healthcare professional to be able to take care of patient experiences is to understand that your patient may have an entirely different perspective than you have, and not to lose sight of that. And a way to illustrate this is that healthcare is complex for many patients. It could be stressful, it could also be scary. Because you have been a part of the system, everything feels familiar to you. You may not, take some situations or some instances to be scary, but to a patient, they may have a completely different interpretation of the visits that they're having with you, and that could be causing them a lot of stress or causing them a lot of anxiety. And so some of the times when you're giving patients directions, do bear in mind and that this may be a stressful thing for them to be able to go from point A to point B. Because you're so familiar with the hospital setting, you may think, oh, just step out and go to the right. But to them, it's a lot more complicated and may induce anxiety for them. So always important to bear that in mind. And same as, some routine activities that may be, second nature to you, may be extraordinary to a patient, and therefore gives them considerable anxiety when it comes to engaging in those activities. Always take time to tell your patients what you're doing, and most especially why you are doing this, because when you're not communicating with the patient or with the service user, they are all in their heads and they are wondering what's going on, and that just may cause a lot of stress for them. So taking that time to engage with them does help in their patient experience, and this is important in order to build trust. And this, even when you are in those busy moments when you may, be less likely to pause and consider your personal biases, you still need to, pay some attention to that, and be careful, some of the things that may slip out during those periods. So we're going to discuss health disparities that are due to race or ethnicity. But before we can do that, let's define what health disparity is. According to the CDC, health disparities are preventable differences in the burden of disease, injuries, violence, or opportunities to seek optimal health that are experienced by socially disadvantaged population. To simplify this, what this statement means is that there are differences in the health outcome of different population groups, and these differences are caused by preventable means, and they therefore lead them to either be experiencing injury or violence at a greater rates than others, and may be affecting their health outcomes. So that is what that definition is. Another way of describing health disparity is that is inequitable, and that it is directly related to historical or current events that may be leading to unequal distribution in social, political, economic, and environmental resources. It's just the way it is. Health disparities do not come by magic. It's not an accident. A lot of the factors that lead to health disparities are very deliberately created and maintained for it to happen the way that it did. So health disparities are often driven by social determinants of health, which is why you have them having this unequal distribution of social, political, economic, and environmental resources. So this is an example of how race, ethnicity is affecting health. So you have this data from the Kaiser Family Foundation that looks at uninsured rates among non-elderly population in the US, and is looking at it from 2010 to 2021. As you can see from this data, that clearly there's difference in the way uninsured rate is happening, for example, in the white population versus in the Hispanic population. So all of these are not happening by chance. They are events in the past or in the future that's led to this being the way it is. So health disparities result from multiple factors that could be poverty, environmental threats, inadequate access to health care, individual and behavioral factors, educational inequities. So for most people, they are experiencing more than one factors that's leading to health disparities. You have they're simultaneously being impacted by more than one factor. So the way that the health is going to be quite different from a person who, for example, is only being impacted by one factor. So an example of how a disparity may affect, we are going to use language for an example. Some patients have difficulty making appointments or communicating with the healthcare system, or and this could be as a result of maybe language barrier, not speaking the language, the predominant language in that place, or having low health literacy and they're not able to obtain prescription medicine, or they may have very low self-efficacy and therefore do not feel confident enough that they are able to engage with a healthcare provider. So all of this does affect the way that they interact with the healthcare system. Ethnic and racial minority groups do have less access to healthcare, and this is primarily due to having lower rates of insurance that happens. And what that often leads is that they tend to forego health treatment or to delay it, and it could also mean that they tend to use the ER at a much higher rates than they need to, and they use it even for minor health problems. And this is because the law requires that ERs provide health care to those who need it, and that ER are not equipped with records or follow-up. So it's something to understand why this happens. So now let's talk about cultural competency. So let's start by talking about biases. So bias is a tendency to favor one's way of thinking over the other. So this is the way that you've been brought up to think, and therefore to you this is the right way to think. That is a bias. So bias in itself is not necessarily bad, but it can be depending on the context, right? So prejudice is, on the other hand, when you are prejudging a person or a group before the facts or circumstances. They may be working on a lot of stereotypes that may not apply to the person or even apply to a majority of people from that place. But you have being driven by biases, you make assumptions about the person. That becomes a prejudice because you are prejudging that person without even understanding how that relates to that person. So we all have a tendency to have some level of biases or prejudice within us. It's just human nature, but you need to recognize your own biases or prejudices and work towards making sure that it is not hindering communication that you're having with your patients, because that can obstruct a good patient care. They may not trust you or feel comfortable with you, and therefore it may lead them not to take healthcare service as a result of feeling prejudiced by you. You don't have to agree with every viewpoint that a patient expresses, but you do have to be respectful of the differences of values or views you hold with the patient. It's important to be honest, to be flexible, and to be kind without exception when you are dealing with the patient group. So cultural biases kind of differ a little bit in biases. Differ a little bit from biases in the sense that cultural biases are kind of specific to culture. Culture defined as a set of acceptable behavior, beliefs, or traits of a racial, religion, or social group. So culture is, strictly speaking, neither good nor bad. It really all looks at it really all depends on how you're looking at it. Therefore, one culture influencing one's behavior, you want to be careful not to have prejudice against a culture just because it's different from the way that you have been raised, that this is unacceptable behavior. So the reason you need to do this is to understand that a person's culture influences how they see the world, and this includes how they are interacting with the healthcare system, their understanding of health and wellness. So you want to be mindful of that. And cultural beliefs do affect how patients perceive healthcare. For example, how they relate to pain, to illness, to injuries. I'm going to use an example of myself. So I come from a place whereby women are meant to be strong when they are giving birth. and you're meant to not accept epidural as a result, because when you accept epidural, you're seen as a weak woman, or if you have a cesarean section, you're seen as a weak woman. So women are being encouraged to bear with the pain and not scream and not shout, to show that they are strong. And this is how you are raised to understand pain, and therefore women go into healthcare feeling that they don't need to show pain. Now, if it's a healthcare setting that has a distinctively different cultural understanding of pain from the way that I have been raised, they may think that, oh, most people when they're in pain they speak up. However, being raised from a different culture whereby speaking up about pain is frowned at, I may not say anything. So therefore, if the healthcare professional does not on his or her own try to ask me questions about how I'm feeling on pain, I may not say anything, and therefore that would lead to an unpleasant healthcare experience for me as the patient. So it's important to bear that in mind. So, and due to some cultural beliefs, some patients may have a bias towards whether to go with traditional medicine or Western medicine as is seen, versus going with natural healers. So it is something to understand. And then it also depends on whether they are going to follow healthcare directives. In some cultures, whatever a doctor says is word, is the more or less to say the word of God. The words that's coming from a doctor is like you have to absolutely respect it. So even when a nurse says the same thing, you don't really regard it until a doctor says that. If you're dealing with someone from such a culture, you as a nurse, for example, you're a nurse, you want to kind of understand that they asking the doctor the same question that they asked you is not necessarily a slight on you. It's just the way that the culture has socialized them. This is not to say that this is good, but this is to explain that this is what may be happening, and as a healthcare provider you want to try to be as mindful of that as possible. And then there's something that is called ethnocentrism, which means that the belief that healthcare providers, especially those who are educated and socialized within the biomedical context, the belief that their value system is superior and is the correct and accurate approach to healthcare. Now, this can cause some challenges in the way that they interact with with patients. We're using an example of a patient that tells a doctor that they are believing God for a miracle, and what the doctor answers is that while we wait for God to answer, let's start you off on this medication. Now, the doctor may not have meant it seriously or as a jeer, but that may be the way that the patient is going to perceive it. So and because the doctor may have said this, because that is how they're coming from, that medication holds much higher value than waiting on the miracle from God. So this is not to say that the doctor is right and the patient is wrong, or the patient is wrong and the doctor is right. It's just to understand that in the manner in which the doctor may have expressed their belief may kind of obstruct communication between the patient, who may feel disrespected, or that the doctor doesn't have any regard for their religious belief. So medical ethnocentrism can lead to many negative consequences in patient care. Particularly, it can hinder communication between patients and healthcare professionals. So it is something to pay attention to. Cultural imposition means when a person believes that when a person or group believes others should adhere to their beliefs, they've decided their own cultural values, their own cultural views are superior, and therefore everybody else should believe the same thing that they do. This does not work in a healthcare system because we are dealing with diversity of patients. So as a healthcare provider, even though you hold those values, of the things that you value, some of the ways you've been raised, or even the way that you've been trained. You need to be careful not to impose your personal beliefs on patients, and because this could reduce the chances that they would have a successful interaction with you, just because they may feel disrespected as a result of interacting with you. So cultural imposition do lead to health disparities, so it is something that is important to consider. So as a way to avoid cultural imposition is to show some respect and be aware of different cultures, and also to be aware when you may be trying to impose your own culture on your patients, and also to try to treat all patients equally. This does not mean treating all patients the same. If you try to treat all patients the same, you are going to end up treating them unequally. So treating them equally means trying to identify the need that the patient has and treating that patient according to their need. And so the patient with more needs gets more attention, more consideration, and the patient with less needs gets a little less of your time, a little less of your attention. So that is an example of treating patients equally while not treating them the same. So healthcare professionals need to be open and accepting of differences that they may encounter when dealing with patients. Being different is not in itself inherently bad or inherently good. It just means it is different. So when you go interacting with patients with that mindset, you avoid cultural imposition or avoid ethnocentrism. So that's something to bear in mind. So for healthcare provider, another very key important is some of the barriers that language brings to it. So by law in the United States, non-English speakers are to receive the same services as English speakers. So you are not going to deny a non-English speaker service just because they don't speak English. So this means that a provider needs to make efforts to offer translation costs, but translation services, but this cannot be at the cost to the patient, and should make also efforts to get forms and educational materials to be translated in situations whereby sign language is necessary or required, to make provisions for that, and to offer interpreters in cases where it is needed or requested as a way to further or facilitate communication with patients. Now, with the third objectives, we're going to focus on delivering diverse services. So we have mentioned all the different ways that diversity exists. So we're going to kind of look at it in terms of sex, gender, and sexual identity. So those who are from the minority groups in terms of sex, gender, or sexual identity typically seek routine or preventive care less often than those who are in the majority. The reasons that they may avoid healthcare services altogether, or to delay it, or to misdiagnosis, is because they may have a sense of either there's been an overt negative attitude that they receive from healthcare providers, or they perceive that there is going to be a negative attitude that they are going to receive. So that can make them to be less likely or less inclined to seek healthcare services. So one way to help with the perception of negative attitude, especially as it has to do with gender identity, is by asking and using patients' preferred pronouns, like asking them what their pronouns is, and if they choose not to answer, you could just call them by their names. And should you encounter a patient that got offended that they were even asked what their pronoun is, you need to kind of take the time to explain the reason why you asked, and hopefully get them to calm down a little bit and understand that you are doing your job and for a good reason. Do not make assumptions about a patient's pronoun based off on how they are dressed or how they look, because that could cause some kind of perceived negative attitude, make them to make assumptions about the kind of care that they're receiving. So it's something to pay attention to. Do use the singular pronoun they, them in a situation whereby you are unsure of what the patient's pronouns are, or they chose not to tell you. And should you make the mistake of calling them by the wrong pronoun, do be quick to apologize. It's always a good idea to start off by introducing yourself and your own pronouns. Example, let's say my name is Florida. I use the pronouns she, her, has. So when I do that, I'm now inviting the patient to tell me their name and to introduce their pronouns as well. Like I said, if you make a mistake, sincerely apologize, and for the most part, most patients are willing to forgive and overlook that. So with religious diversity, it's always important to ask patients what their religious inclinations are and some of the beliefs that they have, and try to make accommodations as much as possible to those religious beliefs while they are in a hospital setting. And religion can influence how a patient interacts with illness or with pain. So do try to be non-judgmental as much as you can, because their beliefs can affect their medical care. So try, if they feel judged by you, they're less likely going to come to use the service, or they may miss appointments or cancel altogether. So an example would be a tradition that is concerned about modesty and is requiring, there's a clinical procedure that requires a patient to disrobe or to show a part of their body. And if that patient requests that a medical professional of the same sex or gender come to do that service for them, you need to be accommodating of that request, even if you're the most knowledgeable or skilled person in the team at that point. So religion does impose dietary restrictions such as fasting days, so be conscious of that, and some of the food restrictions that they may have, or having prayers at a certain times. If you live in a place where majority of people have to pray at certain times in the day, you may want to make accommodations for seeing patients at a later time than typical. And also do take care not to disturb your patients that are your inpatient patients as well. Diversity in age. So the way that you interact with different age groups will change. Your communication style will change, because you're talking to different people, and each different stages or different ages is going to require different communication approaches. If you are you can get trained in how to talk to toddlers or infants or adolescents or elderly, but always understand that you need to make adjustments for whichever great age group that you're talking to. So because toddlers are going to have a entirely different unique strategy for communication from adolescents too. So you want to make sure that you are connecting with your patients. And older adults may have some communication barriers. They may have vision problems, they may have hearing problems, or they may have memory problems. So you, as a healthcare provider, you need to take into account all of this, so that you don't end up making it difficult for them to use the service. And this way they can feel respected, and they can feel heard when they are interacting with the healthcare system. So this is where we end for today's class. Do remember to use the Q&A board if you want, there's anything you require further clarification on. Do have a lovely day. Bye.